Moving on to cardiac veins. So veins is going to be, when we're shooting a coronary CT, as we learn in the morning, we're optimizing the contrast for an arterial phase. If we want to specifically look at cardiac veins, we're going to have to make some adjustments to our scan, but we'll talk about normal anatomy and some of the clinical relevance for this. So coronary sinus is the biggest one, receives blood from most of the cardiac veins, and of course is left to right in the inferior AV groove to join the right atrium. Sometimes it's called the fifth chamber because it has a contractile muscular wall. It has the Thebesian valve and the Vuessen's valve. And the Thebesian valve is located at the orifice of the origin, and it's the largest one. The Vuessen's valve is located at the junction of the great cardiac vein and the coronary sinus, and basically acts as a barrier of plaque flow. And so here's just a schematic of the coronary sinus, the Thebesian valve, and the Vuessen's valve, which is present in about 60% of individuals. And just an interesting fact, as I was looking this up, the coronary veins were first described by Leonardo da Vinci before they were described by these two big names, the Thebesian and Vuessen's, in 1706. So this goes way back. And just a few buzzwords on where they're going to be located. So the great cardiac vein is going to run next to your LAD in the anterior interventricular groove. The middle cardiac vein, it's going to be running in the posterior interventricular vein. And it drains the posterior interventricular sulcus, and it terminates in the coronary sinus. So again, the coronary sinus is basically grabbing all of the drainage there. Small cardiac vein runs in the right atrioventricular groove. The posterior vein is going to be in the inferior left ventricle, so it's going to drain the posterior wherever the PDA runs. The left marginal is also known as the short cardiac vein, and it runs along the left margin of the left ventricle, joining the coronary sinus. One vein of importance is the vein of Marshall. Does anyone recall that name? Maybe from med school. So it drains it's a very small vein, actually. It drains the posterior wall of the left atrium into the coronary sinus. What's interesting about that is it runs right next to the ligament of Marshall. And that area can sometimes be one of the nidus or foci for atrial fibrillation. And anyway, that's sort of like the correlate there. And then the anterior cardiac veins, they drain from the right ventricular myocardium directly into the right atrium. And what's important about that is they bypass the coronary sinus. And then lastly, the Thebesian veins are small veins that drain directly into the cardiac chambers from the myocardium. So different levels of drainage there. And the coronary sinus is obviously very important procedurally. It's important to know some of the variants. So just a schematic here of what I was talking about, the anterior, the left marginal, the oblique vein, and then I have a picture of the left oblique vein, and which is the Marshall, and then the coronary sinus. So that is it. And with that, I think we're going to pass to our two cases.